Poonam Muttreja, let me throw the numbers again. 9 of India's poorest states, home to 581 million or 48% of India's population, accounted for 70% of the country's infant deaths, 75% of under 5 deaths, and 62% of maternal deaths. Now, this is in 2017 numbers I had. Since then, of course, the numbers have only intensified. The worry is, if COVID is hitting a Bengaluru or a Delhi or Mumbai in the manner it has, it's going to spread havoc in rural India. Do you think that was the same complacency that we saw with urban India reflected in what we are now seeing in rural India? Has it been caught napping unawares? We thought this disease will not spread into rural India. Do you think that's the problem? And that's why we are struggling and firefighting, as Dr. Bang is calling it now?
We never cared about rural India even earlier. We have AIIMS and other facilities we still have in the cities, but in rural areas, we have invested very little or next to nothing in the primary healthcare system. And that's where rural India lives. Rural India doesn't even come to district hospitals. So we have totally neglected the primary healthcare sector. We don't have doctors in the villages. We depend on Ashas. Ashas are the ones in March also were doing everything that needed to be done, who are unpaid, incentivized workers. And what have we done to them? We've exhausted them. We haven't paid them. We have a large number of Ashas who are sick, who we have not taken care of. We never gave PPEs or any protection kits to our frontline health workers. How are you expecting right now that they will be able to deal with people dying, people not having any oxygen in a primary healthcare center is a rare commodity, and the community health centers also, the state they are in, and they're very far, people find them inaccessible. So our rural infrastructure is a reflection on how little we care about our rural people. Second answer to your question is we thought it didn't go to rural areas. We were very proud that COVID was an urban phenomena, and it didn't. There was very little COVID in the rural areas, fortunately, in the first wave. So at this point of time, we hadn't thought at all. We hadn't planned. Our government is sleeping. We had 1 year to prepare, as Abhay rightly said. We were told we were closing down when we had a lockdown at 4 hours notice. It was because India was going to prepare for COVID. We did not prepare at all in the rural areas, other than putting forward Ashas to go and do surveillance and to go household,
so what should we do?
Check. But
give me the solution.
I just want to say, at least we had quarantine.
Give me the solution. What according to you is the solution then?
The solution is right now, as Abhay also said, you have to fight the people who are infected. Behavior change, communication has to be, we have to reach out to our people. There's no communication we have done with the large number, from the center to the state and at the district level. Involve panchayats, ashas, frontline workers, do short trainings. We can do half-day, one-day trainings online. We've been doing it for the community workers. You use panchayats and the televisions in panchayat houses to panchayat ghars to train them on basic what they need to do when there are mild symptoms, how to treat, how to segregate, how to quarantine, and where there are severe cases, where to take them. You have to decentralize this. You need the collector. We don't need the PM telling the country what to do. We need the DM. We need the collector in charge of districts for COVID. And they have to focus all their energies right now on COVID. And we have to reach medicines. We have to reach paramedicals. We have to reach what we can in a firefighting mode to the rural areas. Right. But you will say we don't have it for urban. How do we get it for rural? Bring in the army, bring in all the other railways, everybody, but send them for God's sake to rural areas. to manage with the DM. We need to also help the DMs understand what needs to be done and then work at the village and district level. And if you give the responsibility to panchayats and the people, that's the only thing I can see right now. I cannot expect trains and buses of loads of oxygen and doctors going to the villages immediately. Right. But it is people themselves. They have the resilience, they have the capacity, and our frontline health workers are not just ASHAs. Let's involve ASHAs, ANMs, and Anganwadi workers. I call them the 3 aces. Wherever I've seen given responsibility, they do very well. Let's invest in them in right now and also make funding available.